Yeah, good afternoon, respected judges and audience. I am here to present my research work on evaluation of OCT angiography changes in non-arthritic ischemic optic neuropathy. I would like to acknowledge the support of my co-authors for this study. There are no financial disclosures for this particular study we have. So as we all know, NAIN is a common optic neuropathy of elderly population where the site of affliction is mainly posterior ciliary arteries which have hypoperfusion resulting into the ischemic insult of the optic nerve head followed by optic nerve head edema. FFA and ICG have been used to delineate these vessels but unfortunately have been unsuccessful. So OCT-A is a non-invasive modality that can delineate these microvascular plexus at different level, both at disc as well as macula. So multiple studies have shown that peripapillary vascular loss on OCT-A in NAIN patient when compared to the control eyes, papillitis and papilledema. So they have been diagnosed to differentiate these conditions. It would be an interesting thought to explore what happens to the macular microvasculature and what is the effect of NAIN on the macular vasculature in these patients, and also to understand the natural history of NAIN. Maybe this longitudinal study may help. So with that aim to evaluate the longitudinal microvascular changes at disc and macula over the course of 6 months in patients of NAIN. So this was a prospective longitudinal study where after taking the ethical clearance from the Institute Ethics Committee, 15 patients of NAIN were included in the study along with the age-matched 15 control eyes. The criteria for inclusion was 6 weeks from the onset of the symptom. We excluded all those conditions which may affect the retinal vasculature directly or indirectly. Informed consent was obtained and all patients underwent detailed ophthalmic examination including visual acuity, contrast, color, Humphrey visual fields and OCT angiography. The investigations were repeated at 3 and 6 months. So OCT-A, we use web source OCT and we scanned the disc with 4.5 by 4.5 mm circle, and the vessels were studied at the level of optic nerve head, where we studied the peripapillary vessels, then radial capillary vessels, and also the choriocapillary vessels. Similarly, macula was also studied at the level of superficial capillary plexus, deep capillary plexus, and the level of choriocapillary plexus. Once these are just the representative images at various levels at the disc and at the macula. So once we have obtained the image, the quantitative assessment was done with the help of images software, where we opened the image in the images software. We applied the minimum thresholding program to delineate the major vessels. The same image was again opened in a new window where we applied the Felsenker algorithm to delineate the total vasculature, and the number of pixels for each image were counted. So to obtain the microvasculature, we took the total image and subtracted the major vessels from it so that the microvascular is counted, and then it was divided by total number of pixels in the image to get an index. So this was done at all levels for both disc and macula, and we found and results were that the mean presentation from the onset of symptom was around 4 weeks, and almost 12 patients had some or the other kind of systemic association. The presenting visual acuity was very, very poor. When compared to control group, all the parameters at the level of disc and macula showed this significant difference from the control group. The NAIN patient showed the significant difference from the control group. Coming to the OCT-A trends at the level of disc, we found that there was continuous decrease in all the parameters except for the choriocapillaries level, which remain more or less stable. Both the superficial peripapillary as well as radial peripapillary capillary vessels showed decrease, which was probably due to decreased metabolic demand as a result of RNFL atrophy. Coming to macular parameters, we found that all the parameters, although were less than controls at the presentation, at 3 and 6 months, they remain more or less stable. We also correlated these parameters with the visual function, particularly visual acuity, contrast, and we found that the disc parameters correlate well with the visual acuity as well as contrast sensitivity. So to summarize, a significant low peripapillary microvascular density at all levels at the level of at presentation were seen when compared to control group, which is similar to what has been observed by other researchers. And they tend to continue to decrease over a period of time, maybe because of reduced RNFL thickness. Superficial muscular vasculature also show reduction at presentation, however remains stable thereafter, which is similar to what has been observed by Fard and Tau et al. While deep musculature, though not observed by other authors, but except for Astberger et al., we also found a similar result that they were less as compared to control at presentation and remained stable later on, probably suggesting of some concurrent retinal ischemia, which needs to be evaluated further. So to conclude, OCT-A may be a useful tool to delineate the microvascular structure of retina and help in understanding the natural history of NAION. The study is limited by its small sample size, and we cannot exclude the segmentation errors due to the presence of edema. These are my references. Thank you.
Thank you very much. Please.
Nice study.
Thank you, sir.
Just wanted to know, the one limitation which you have told is very, very pertinent, the segmentation error.
Yes.
In presence of edema, especially the deep, which you found and the others didn't find, was probably because of the segmentation errors.
Could be.
How you explain, because how you explain the macular changes which you saw, and what was the progression of these changes?
Yes, sir, that's very interesting. And when we reviewed the literature, we found that only 3 studies are there as far as the macular vasculature is concerned. So out of them, 2 have reported that there's no change. One has reported at superficial level, yes, all of them said that there was some change, but at deeper level, they said that there was no change except for 1 study. So we feel there could be two hypotheses behind it. One, probably because as a result of optic neuropathy, there is loss of GCL ganglia, GCL layer also, which due to the decrease in metabolic demand, probably the vascular is also affected. The second possibility could be because that due to increase in edema of the disc, there could be a compartment compression kind of a system which is compressing the vessels also at that level. So still needs to be.
You have so many of concomitant abnormalities, diabetes, hypertension, all of them, even without having retinopathy, they cause changes in the vessel density.
Yes, sir, that's a very valid point, but then most of the NAION patients do have this systemic association, so there is no way we can, take, yeah,
cannot be.
Yes.
Congratulations, wonderful presentation.
Thank you.
I just have an imaging question. You used image. Did you set up a threshold for it? For the images?
Yes, we first converted into an 8-bit image, and then we used minimum threshold logarithm to delineate the major vessels and Falsenker logarithm to delineate the total structure.
Okay, so in that case, you would miss out on subtle changes along with the edema that you're already mentioning.
Yes.
You'd miss out. So isn't that a limitation of your study, the imaging limitation of your study?
Yes, maybe. Yeah.
Okay.
Thank you.
Thank you.